YouTube. It's Ben Maiden. How are you? I'm coming in to give you an update on my day 3 post-op for the vitrectomy ERM surgery of my right eye. So, this is just an update for those of you who are interested in the ERM journey and restoring my vision to hopefully closer to normal than it used to be. The ERM is something that affects people, certain people, and it's called ERM stands for epiretinal membrane. And what they do to correct the issue is they do a vitrectomy called the plana, where they put you to sleep and they insert 3/4 into your eye. You can watch videos on YouTube if you're interested. I wouldn't recommend it unless you have a strong curiosity. But anyway, I was sedated completely under at the hospital. Surgery was done in the hospital. Some of them may be done in outpatient surgery center, but it's the surgery center outpatient that's in the hospital because they had the special eye equipment that was needed for the surgery. So anyway, the surgery was about an hour, and the surgeon said everything went well, that he peeled off a number of layers, and he was surprised how many layers that actually on the central vision portion of my retina. He also said there was some cells that were stuck on the retina in a different place that he couldn't get them off because they would have pulled or torn the retina. So he got it off as much as he could in the central vision area, which was the area that was so important. So meanwhile, all these people are texting me, sorry, and I'm sorry if that distraction, but meanwhile, doing pretty well. I'm a little tired. I sleep on and off. When I normally sleep, I put the patch on my eye so that I don't touch it by accident. And I've noticed that I do get a burning sensation after about 4 or 5 hours of sleep, and it causes me to wake up. And I usually get up and take a pain pill, open my eye, and let the drainage come out. It's like tears that are coming out, and I think maybe the buildup of the tears under the eyelid causes the burning. I'm not sure. But as I positionally change myself, like now I'm in the recliner, I don't have that issue because my head's elevated and the draining just takes place. So anyway, right now, I normally wear these glasses for a distance, like to watch TV across the room or to drive. I'm a nearsighted person, so I can see pretty well without my glasses normally. What happened is that about last June, I started noticing a change in my vision, and that I would be looking at my computer doing my work, and then I would turn away from the computer, and I would look back at it, and I couldn't read the print. It started freaking me out, and turns out that these cells were just, layering themselves more and more onto my eye. And about 3-4 months later, September, October, I went to 2 different surgeons, retinal specialists, to have a consult on what's going on with my eye. And so I have this epiretinal membrane, and he explained it's like taking a piece of paper that's flat, and then it crumples it up. The jelly sort of grabs hold of the retina when the cells are on top pulling, and it makes like a crumpled piece of paper. And that when they do the surgery, it smooths the paper out, but the paper is never completely flat. So if that makes sense, well, hopefully my vision will be restored to the flat piece of paper that is just not perfectly flat. So better than it was, hopefully, but not necessarily perfect. Okay, so that's the story. That's the update. It's relatively painless. I have taken some pain medication off and on because of, I get a pain. If I move my eye like to one direction or the other, or try to look, like make a drastic move with the eye, it does give me a dull pain, so I avoid doing that. I do keep it open unless I'm sleeping. My eye is just normally like it would be. It's doing its thing. It's quite swollen. It does have a lot of redness and blood inside the eye, or staining, whatever you want to call it. That's going to go away. But I'm going to unveil it for you, take off my glasses, and give you guys a good look so you know what to expect for yours if you're going to have it. So anyway, hopefully it will just get better and better over the next 2 weeks, is what the doctor said. And I'll be going back next week for my second post-op. I had the first post-op the day after surgery. They removed the patch, and then now I just wear the patch at night. I insert 3 type of drops: a steroid drop, prednisolone, 4 times a day, tobramycin, an antibiotic that I'm able to take 4 times a day, and something called atropine, which I believe keeps the dilation of the eyeball open, and I put that in twice a day. So the eyeball was refilled with saline and collagen. The doctor told me, he said there's no way other than that to do it, and I had no idea, so I did ask the question, like, did you drain my eye out and fill it back up? And they're like, yeah, we did. That's how you do it. I'm like, okay, good. At least I was asleep. I didn't want to know anything about it. Just that it's finished, and that's all. No memories. That was my simple request. I want no memories of this surgery. So I highly recommend you all do that if you have the option to. So if you don't want to see, please turn the video off now. And otherwise, I'll unveil and show you the eye, what it looks like on day 3 post-op. Plana vitrectomy for ERM removal, or ERM peel, as they call it. Okay, so here you go. There's the eye, looking mighty spiffy. And I do have a fresh Kleenex. I'm going to grab it. And I just dab the outer corner. You know, I don't want it in my eye, just to make sure. So here it is. I'll try to give you a little view of it. It's looking mighty angry, and my eyelid's swollen up. But hopefully, it'll be getting normal soon. Okay, guys, if you have any questions about the surgery, or how I came about the decision to have it, why I had it, any questions at all, feel free to give me a call, reach out. Feel free to leave me a message. Sorry, I'm just a little out of it. Okay, guys, ciao. Thanks for subscribing, and tune in for my next update on my ERM removal. Have a great day.